Hi, my name is Kweko. I'm a pharmacist. In today's video, I want to talk about the benefits of taking a daily aspirin, what we normally call daily aspirin therapy. We're going to look at some of the pros and the cons. We will look at who stands to benefit the most, and also we'll evaluate some of the risks associated with taking a daily aspirin. But this is one thing that I will highly recommend that you discuss with your doctor before making any changes to your healthcare or any changes to your prescription regimen. Now, aspirin is a common medication that many people take for pain relief, fever reduction, or inflammation reduction. But some people also take a low dose aspirin every day to prevent heart attacks and strokes. This practice is called daily aspirin therapy, and it has been widely recommended for people who have a high risk of cardiovascular disease. However, recent studies have shown that daily aspirin therapy may not be beneficial for everyone, and it may even cause serious side effects such as bleeding. So the question is, who should take a daily aspirin and who should avoid it? Now, before we answer that question, let's take a brief look at the science behind the daily aspirin therapy. Daily aspirin therapy works by inhibiting the production of a substance called thromboxane A2, which makes platelets stick together and form blood clots. Now, by inhibiting this thromboxane A2, you prevent the formation of blood clots and thereby preventing or lowering the risk of heart attacks or strokes, which may be caused by blocked arteries. Now, at face value, this is a good idea and all of us should be taking a daily aspirin, right? Well, not so fast, and let me explain. Now, let's start by first looking at who may benefit from a daily aspirin therapy. Now, a daily aspirin therapy may be especially beneficial for people who have already had a heart attack or stroke, or who have a known heart or blood vessel disease. This is called secondary prevention, and the benefit of daily aspirin therapy in this situation is very well established. There is no denying or there is no dispute in that area. Now, daily aspirin therapy may also be recommended for people who have a high risk of having a first-time heart attack or stroke within the next 10 years. And this is usually based on factors such as the age, blood pressure, cholesterol levels, diabetes, smoking status, and family history. This is called primary prevention. And the benefit of daily aspirin therapy in this situation is less clear. This is because for this group, there may be instances where the potential benefit does not necessarily outweigh the potential risk. Now, talking about risks, let's look at some of the main issues with daily aspirin therapy. Now, the main risk is bleeding, which can occur either in the gastrointestinal tract or in the brain. Now, bleeding can cause ulcers, anemia, a hemorrhagic stroke, or even in severe cases, death. The risk of bleeding increases with age, the dose of the aspirin, the duration of use, and other medications that affect blood clotting, such as warfarin, clopidogrel, or any other blood thinners that the person may be taking. Or even the individual's general health status can also influence whether they're going to experience this bleeding or some of these risk factors. Now, several studies have found that daily aspirin therapy may not be beneficial for healthy older adults who have no history of heart attack or stroke. For example, in a study called Aspirin, which stands for Aspirin Reducing Events in the Elderly, which involved more than 19,000 people aged 65 and older, who were randomly assigned to take either 100 milligrams of aspirin or a placebo daily for an average of 4.7 years. The study found that aspirin did not lower the risk of cardiovascular events or dementia, but it rather increased the risk of major bleeding by 38% compared to a placebo. Another study called the ARRIVE study, which stands for Aspirin to Reduce Risk of Initial Vascular Events, involved more than 12,000 people aged 55 and older who had a moderate risk of cardiovascular disease but had no history of heart attack or stroke. The study found that the aspirin did not significantly reduce the risk of cardiovascular events over a median follow-up period of 60 months, but it increased the risk of gastrointestinal bleeding by 60% compared to the placebo. So what is the bottom line and what is the conclusion? Well, the bottom line is that daily aspirin therapy is not a one-size-fits-all approach to prevent heart attacks or strokes. It may be beneficial for some people who have a high risk of cardiovascular disease or who have already had a heart attack or heart-related event, but it may be harmful to others who have a low risk of cardiovascular disease or who are older and healthy. Therefore, it is obviously important to talk to your doctor before starting or stopping a daily aspirin therapy. I mean, your doctor knows you best. He knows your risk factors, and he will be the best person to guide you into taking a decision as to whether a daily aspirin therapy may be beneficial for you. Thank you for staying through. I hope you found some value in this video. On your screen is another video that I think you will find interesting. Stay blessed and catch you on the next video.